Hi guys, it's Dr. Arya with Arya Foot Ankle. We wanted to talk to you today about one of our favorite things in the office, and that is our x-ray machine. Sometimes people don't know we have a full x-ray machine. Not only do you get the x-ray machine, but you get the visuals of your x-rays after the x-ray, and you get the doctor to go through it with you. So we really like having that because it helps with immediate diagnosis. That's really useful to make sure that the patient understands what's going on and we can figure out how to make you better quicker. So we love having the x-ray for that reason. The other thing is it's enhanced convenience overall. You come in, it's one-stop shop. We check to make sure something's broken, and either it's broken or it's not. We can kind of make those decisions right there. We also like it for treatment planning. So overall, we can decide, what the next steps are. It really helps because if we need to order like an MRI, we can, but we like to start with just an x-ray to check the bones and the overall structure of the foot. The other great thing about it is it helps with precise diagnostics and increased accuracy. So if I'm not sure what's exactly going on by the clinical symptoms that a patient tells me, it's really helpful to just go ahead and look at it. And then we can decide whether it is or isn't broken, if it's something related to the structure of your foot, if there's something related to the soft tissue that we can see an indication, like a spur or an accessory ossicle. Sometimes those pop up on x-rays. And sometimes we say, you know what, let's get an ultrasound. And the cool thing is we have ultrasound in our office too, and that's really helpful for diagnostics of the soft tissue. The other great thing is we can kind of streamline people's healings. So if we notice something's broken, whenever you come in for your checkup, you just come right here. We'll get an x-ray every 2 to 3 weeks to check the progress of the healing of the bone. And that's a really easy way to keep you in the loop about your own care. We can look at the progress together, which is exciting. And we can just kind of keep it all in-house and get it done in an efficient way. And then my last most favorite thing about having x-ray in office is being able to educate patients about their feet. So we're going to look at an x-ray up close together in just a minute. So like I said, one of my favorite things is to show patients exactly what's going on in their foot so they can understand for themselves the overall structure and why we need to do certain things we need to do. For example, in this x-ray, if we say there's a little bit of arthritis here at the big toe joint and we can see this little fleck of arthritis, we can say that, this is a good candidate, or somebody, if they're having pain that it correlates with that, we can say, we need to add a little bar or a little wedge on the orthotic to help decrease the amount of friction that happens with the toe. So it's really helpful from a structural standpoint to be able to actually look at an x-ray. The nice thing too is we can see it in every view. So I've had it before where I see something like an accessory ossicle on a patient. So I'll show you an accessory ossicle, which is just like an extra bone. I can see that accessory ossicle in one view, but I can also see it in this view. And so it's nice to have confirmatory with more than one x-ray, and we can just do it right here. I've had it before where I've noticed something in somebody's foot and I say, you know what, we actually should get a picture of the left side to see if there is a correlation or a similarity, so I know if this is abnormal overall or if this is normal for you. Your right and left foot may have the same accessory bone. And so it's really helpful because we can real time make that decision. We set the patient back up on x-ray and we just get another x-ray. So it's one of our favorite things. I also have an ultrasound machine. We'll do a video on that too and the benefits of ultrasound. But I just wanted to share with you guys how excited we are about our x-ray and how we can provide more service to patients in the office right here at Arya Foot Ankle. Thanks for watching.